radiology, if one kidney gets affected, of the obstruction neuropathy, that kind of goes into the obstructive nephropathy. So these are what are the impact of obstruction, degree of obstruction, that is partial or complete, unilateral or bilateral, acute or chronic, that is time-based, baseline of the condition of the kidney, potential for recovery, presence or absence of the UTI. These all are the impact of obstruction that will produce the obstructive neuropathy and nephropathy. So, what are the presentation? This type of patients, how they present that? Actually, they have the urinary features if there is a lower tract obstruction. If obstruction is at the level of urethra and bladder, that is the distal obstruction. That is obstruction in the lower tract. The features will be, the clinical presentations will be, hesitancy may start in urination, force will be decreased, weak strain, tunnel drifting, burning of the burning on urination, of the urine, and you will land up with like a urinary infection. Having the hematuria, if the hematuria is gross, frank, paleness, that is coming from the blood, is coming from the upper tract. That's just kidney, from the kidney. So gross hematuria, having the upper tract, ureterus obstruction at the level of ureter. So the obstruction at the level of ureter and kidney, obstruction at the level of bladder and urethra. If the obstruction is in the upper tract, then most of the time the clinical features will be the system. Then patients will present with a fever with chills, nausea, vomiting, cloudy urine with infection, and if there will be bilateral cases, the patients will be having the uremia and so how you diagnose this type of patient? So suppose you have the problem of the obstruction in the urinary tract. So how will you reach on the diagnosis? How will you know that what is the problem is going on inside? So the preliminary investigation, that is initial investigation, is the ultrasound. Ultrasound is the initial investigation that will say you the lot of things. That is the anatomic study. Of course, this is not a functional study, but nowadays the recent version of ultrasound, that is the modified version, having the Doppler modification, may add the functional component. It will give the size of the renal parenchyma, thickness of the bladder wall, ureteral wall. So, however, that is the initial investigation, but it has potential to diagnose the CKD patient. That is, it can diagnose the chronic renal failure of patient. How it diagnoses the chronic renal failure of patient? Because it gives the size of the kidney, ecogenicity, corticomedullary differentiations, and refractive index that depends on the flow of the blood in the renal patients. So if the refractive index is more than 0.7, that is the patient having the obstructive neuropathy. So that the chronic kidney disease, by that and refractive index, that we can diagnose the chronic kidney disease, that is renal failure patient, by the ultrasound. So we can the higher versions having the ultrasound, having the higher version that can diagnose the crossing vessels and ureteric pelvic junction obstruction. Now this type of picture is contained in the ultrasound, and if you want to be the radiologist, then you have to know that this is the picture, normal picture. Ultrasound is how you diagnose the patients having the obstruction and obstructive neuropathy. ECU can get the obstruction, and there is when you can handle. Next investigation is the IVU. IVU, that is supposed to be the gold standard. And delayed program and pyrogram, that's also say you the anatomic level of obstruction.